why was Mission Indradhanush even needed? Because it was seen that despite so many years of universal immunization program and prior to that expanded program of immunization, these have been running since 1978. The immunization coverage was only 65%. Immunization coverage means percentage of children under 2 years who can be classified as fully immunized. So Mission Indradhanush was launched by the Ministry of Health and Family Welfare, that is the central government of India, in December 2014 with the aim of actively going out and achieving full immunization coverage of 90% by 2020 and simultaneously boost the routine immunization infrastructure in the country so that this higher immunization coverage is sustainable. So what was planned in Mission Indradhanush was that the children under 2 years of age need to be approached and completely immunized. In addition, pregnant women would be immunized for tetanus toxoid. Initially, when the mission was launched, it started with 8 vaccine preventable diseases, that is vaccines for these diseases, and later as more vaccines were introduced in the routine immunization, they were also introduced in the mission immunization. Japanese encephalitis was provided in selected districts which were endemic, and Haemophilus influenzae type B were provided in phased manner. This was a nationwide initiative with special efforts on 201 districts which have the lowest performance in immunization, full immunization coverage. Mission Indradhanush was carried out in 4 phases. Each phase covered some selected districts and the other phase, other selected districts. Each phase conducted 4 rounds of 1 week duration in each month. 4 rounds of 1 week duration in each month to catch up the children who were either partially immunized or totally unimmunized, and the pregnant women who were not immunized for tetanus toxoid. In addition to the vaccines, those children who had diarrhea or dehydration were also given ORS packets, zinc tablets, and vitamin A doses were also given as it is given in routine immunization. The vaccines which were given under the mission in these rounds were entered in the maternal and child protection card and were counted towards routine immunization. And since the launch of Mission Indradhanush, after it finished, it was seen that full immunization coverage had increased by 5% in some areas and 7% in other areas, and somewhere in between in the remaining areas. Seeing the success of Mission Indradhanush, it was realized that it was possible to intensify the efforts and achieve the 90% full immunization coverage even before, that is by December 2018 instead of 2020. Hence, the efforts were intensified and the new mission was called Intensified Mission Indradhanush. For this revised target, the mission was renamed as Intensified Mission Indradhanush. Under intensified mission, even greater focus was to be given to urban areas. It was seen that in Mission Indradhanush, the urban areas were left out because they do not have the usual infrastructure of ASHAs, ANMs, multipurpose workers, sub-centers. So it was found that the gap in Mission Indradhanush was that urban areas were left out. So in these areas, 4 consecutive immunization rounds were held, like before, for 7 days, each round for 7 days, every month between October 2017 and January 2018. The low performing areas were given high priority and urban areas were given high priority, like low coverage pockets in the subcenter, that is in rural areas, and urban slums which have migratory population. This was again carried out in 4 phases, but this time after proper procedure, micro planning, that is enlisting the beneficiaries in each area, mobilizing these beneficiaries, that is they should ensuring that they come for vaccination because of intensive publicity, and training the workers like ashas, ANMs, so as to be highly efficient and immunize the maximum number possible. Another highlight of intensified Mission Indradhanush was that after the mission got over, a coverage evaluation survey was done in 2018, and that showed an impressive increase of 18.5% in full immunization coverage. But still there were some districts which were left, which the immunization was still low, and hence intensified Mission Indradhanush 2 was planned to cover these 271 districts where the immunization was still lower than the target. The mission obviously focuses on areas, districts and blocks which were left out from earlier immunization drives, the dropouts, those families which were resistant to immunization, and those who are living in hard to access areas, so were not covered under previous 2 missions. Intensified Mission Indradhanush 2 aims to achieve 90% full immunization coverage across each and every block of India by 2022 and maintain it. So intensified Mission Indradhanush will target the district which have either an immunization coverage of 70% or lower, and those districts or blocks where the various surveillance like polio surveillance is going on in the country, vaccine preventable disease surveillance is also going on in the country. So analyzing that data, if it shows that measles incidence is more than 10 per lakh population, those districts will be covered, and those districts where diphtheria and pertussis incidence was found to be more than 1 per lakh population. So these was the criteria for choosing the districts in which IMI-2 will be targeted. IMI-2 will consist of 4 rounds of immunization and will be completed by March 2020 itself. What is characteristic is more ministries other than Ministry of Health and Family Welfare have come together to increase this coverage, like Ministry of Women and Child Development, Ministry of Panchayati Raj, Ministry of Urban Development, Ministry of Youth Affairs and others which are required to make mission a resounding success. So the salient features of IMI-2 are conduction of 4 rounds of immunization of 7 working days, which means no Sundays, no holidays which are falling in the 7 days will be counted, and 7 working days. If the routine immunization day of that particular block happens to fall in those 7 days, then that day will not be counted and another day will be added. So 7 working days for particularly this mission only. The immunization session will have flexible timing, that is the local worker, health worker would assess the most convenient timing for the beneficiaries to come so that they can come in higher numbers. And if required, even mobile vans or whatever transport can be used to have a mobile session. And obviously this will require coordination with local departments other than the health department. Then enhanced focus on those who were left out in previous missions, those who dropped out, and especially resistant families and hard to reach areas like urban slums, underserved population, tribal areas which could not be completely covered in previous 2 missions. Interministerial and interdepartment coordination is characteristic of IMI-2. In addition to these 7 rounds, great efforts are being taken to strengthen the routine immunization system, that is wherever the immunization session will be held, efforts will be made to improve the infrastructure, local infrastructure for storage of vaccines, to improve the supply chain of vaccines, of syringes, needles, diluents and staff, so that the routine immunization system of those low performing areas is simultaneously improved so as to sustain this high coverage of fully immunized children, because the gains achieved through the incentivized missions need to be sustained through strengthening of local immunization systems.